Metabolic syndrome. What is metabolic syndrome and why are we talking about it? Metabolic syndrome is a cluster of specific risk factors. When we have 3 or more of these health conditions, the risk factors, it indicates an increased chance of developing cardiac complications like coronary artery disease, heart attack, stroke, or diabetes. You may also hear this cluster of conditions called other names, including Syndrome X or dysmetabolic syndrome. What exactly are the risk factors of metabolic syndrome? The cluster of risk factors indicating the diagnosis of metabolic syndrome include: first risk factor, high blood pressure. High blood pressure is defined by a systolic blood pressure, that's the top number, of 130 or greater. Our blood pressure is measured as millimeters of mercury. And then the bottom number, the diastolic blood pressure, of 85 or greater. So for blood pressure, that would be a value of 130 or greater over 85 or greater. About 1 in every 4 American adults has high blood pressure, also known as hypertension. Blood pressure may increase with age, between 40 and 50 years, or be the result of lifestyle or other medical or genetic condition. Whatever the cause, it's extremely important to know and monitor your blood pressure. With blood circulating at a constant, high, harmful level, this force eventually damages our arteries and the organs supplied by the arteries, especially our kidneys, our eyes, and our heart. Blood pressure, when it's high, may be symptomless. We won't feel anything. If we have high blood pressure, medication is very effective to control this condition and prevent the vessel and organ damage. Second risk factor, insulin resistance, or sometimes called glucose intolerance. This is when the body can't properly use insulin and a blood test shows high fasting blood sugars. And that's measured by a fasting blood glucose test. A value of 100 milligrams per deciliter or greater indicates a high value. Sometimes we'll see this listed on our blood test paperwork as FBS, so a value of 100 or greater would be positive. Third and fourth risk factors involve elevated cholesterol levels, specifically a low HDL cholesterol level, and that would be less than 40 for men or less than 50 for women. And also a high triglyceride level of over 150. A little bit more on cholesterol. Cholesterol is a fatty substance that's an important part of our outlining of all our cells. 80% of our cholesterol is produced by the liver. The other 20% is directly from our diet. Our cholesterol levels can be determined by a blood test. For the most accurate reading, we should fast at least 8 hours prior to the blood test. All the different types of cholesterol and their values can be confusing. A lipid panel is the blood test that will measure each of these values. Again, there can be a lot of confusing numbers, so to summarize, we will see on our paperwork for the lipid panel, HDL, and HDL stands for high density lipoprotein. That's the good cholesterol. HDL offers protection from buildup in the arterial walls by helping move out LDL, preventing it from sticking to the arterial walls. A value of above 60 is positive. LDL, and that's often called bad cholesterol. That's the cholesterol that sticks to the arterial walls, forming a buildup leading to coronary artery disease. And we want to see a value of less than 100 for the LDL. Total cholesterol. This is HDL plus LDL. And we would want to see the sum of our HDL and our LDL less than 200. Triglycerides. Triglycerides are fatty substances in the blood. Elevated triglyceride levels are highly associated with coronary artery disease, obesity, a low level of the HDL, insulin resistance, and small dense LDL particles. We want to see a value for the triglycerides of less than 150. And the fifth risk factor for metabolic syndrome is increased waist circumference, sometimes called abdominal obesity. For men, that would be 40 inches or more. For women, 35 inches or more. Abdominal obesity is dangerous because it's composed of visceral fat. Visceral fat is also known as organ fat or intra-abdominal fat, and it's located in the peritoneal cavity, packed in between all our internal organs in the torso. Visceral fat differs from and is more harmful than other types of fat as it surrounds our internal organs. It's harder to lose because it's deeply embedded in our body tissues. An excess of visceral fat results in an apple shape. This body shape is highly associated with cardiac issues and diabetes. Visceral fat is one result of inactivity. A diagnosis of metabolic syndrome can be a wake-up call, a warning, and an opportunity to make positive changes and avoid more serious cardiac issues like coronary artery disease, heart attack, or stroke. Although metabolic syndrome is a serious condition, you can reduce your risk significantly by reducing our weight, increasing our physical activity, eating a heart-healthy diet that's rich in whole grains, fruits, vegetables, and fish, and working with your healthcare providers to monitor and manage blood glucose, blood cholesterol, and blood pressure. Know that you are not alone. Metabolic syndrome is quite common. According to the American Heart Association, 47 million Americans have it. That's almost 1 out of every 6 people. Adults who continue to gain 5 or more pounds every year increase their risk of developing metabolic syndrome by up to 45%. To summarize, metabolic syndrome is having 3 or more of these risk factors. High blood pressure, 130/85 or greater. High fasting blood sugars, greater than 100. High triglyceride, greater than 150. Low HDL, less than 60. Increased waist circumference, 40 inches for men, 35 inches for women. Treatment of metabolic syndrome. The goal of the treatment is to reduce your risks of heart disease and diabetes. We can do this by making positive lifestyle changes with losing weight, learning to eat healthier, and increasing our activity. In addition, we may need to consistently take medications that control our blood pressure, our blood sugars, or our cholesterol levels. We can see our progress with blood testing for blood sugars and cholesterol levels, as well as blood pressure testing and weekly checking our weight. You may be thinking, well, I know what to do, I just need to do it. And if that were true, we would all be doing it and we wouldn't have the diagnosis of metabolic syndrome so prevalent. Working with your healthcare providers can help target the changes that will give you the best results. Learning of the diagnosis of metabolic syndrome can be the opportunity to learn and change and reverse this cluster of symptoms. If you have any more questions, come hang out with a health educator to discuss more. Thank you.